composite's not as strong as your own natural teeth, so it does chip and it does stain. Okay, let's answer some Dear Dr Manrina Rhode questions. Here is our first letter. Dear Dr Manrina Rhode, I'm hoping you might be able to help. I've had composite bonding for the past 6 years. The first time I had it done, after around 3 years, I noticed a lot of staining and chipping, so decided to redo it. I'm now 3.5 years later and finding the same situation has happened. I'd like to get some advice on whether I undergo another round of bonding or explore another route. Will the new bonding just be adding on top of my existing bonding, or is there a way to remove what's already there and essentially start again? My other thought process was whether I need to look at porcelain veneers, but I would like to understand again, can these be fitted on top of existing bonding, or does the bonding get removed first? I've also seen horror pictures of teeth being filed down to pegs, which is something I would want to avoid. Is this always necessary? Lastly, with veneers, do they always need to be replaced? And if so, after how long? Do they stain like bonding does? Sadly, I'm a lover of coffee and red wine. I don't know if that's sadly. Sorry for all the questions, but any insight you can offer would be greatly appreciated. Thank you so much. Okay, let's have a look at this letter. So you've had composite bonding for the past 6 years. After about 3 years, you noticed staining and chipping, so decided to redo it. So the thing with composite bonding is it's made up from small pearls and they wear away at a rate different from your own tooth. So as you eat and brush and bite into things, your composite wears away, and that's why you end up getting chipping, or you could feel a ridge between the composite bonding and your own tooth. Also, composite's not as strong as your own natural teeth. Depending on your habits, it could chip. So definitely if you were fingernail biting, opening packets with your teeth are not tools, don't do that. Definitely if you had habits for eating harder things or eating off a bone, for example, like a chicken wing, could cause your composite to chip. So it's definitely, composite bonding is something, it has its benefits in that it can be added to teeth without preparing any of your own natural tooth structure, taking any of your own natural tooth structure away. But contraindications are one of the things with it is that it does chip and it does stain. So so that's perfectly normal that you experience that. You'd like to get some advice on whether to undergo another round of bonding or explore another route. So it's completely up to you. There's no harm in just keep topping up your bonding as and when you need it. Typically, we would expect composite bonding to last about 5 years. So if you're finding that your bonding is chipping or staining before that, it could be to do with something that you have within your own lifestyle, something within your diet, some habit that you have. That means that it doesn't last quite as long as the average. And so it would be interesting to address that and kind of look into what it is that you're eating or that you're doing that's causing it to chip. Obviously, if it's because you're grinding your teeth, then we'd want to get you in a night guard. If it's that you're biting your fingernails, we'd want you to stop that habit. So you really want your dentist to work as a detective and work with you and find out what it is that's causing your bonding to chip and stain and see if that can be addressed so that it lasts longer for you. Will the new bonding just be added on top of my existing bonding, or is there a way to remove what's already there and essentially start again? So composite bonding can be added to composite bonding as long as the bonding you're adding to is clean and healthy and there's no bacteria or decay or stain on it. Can porcelain veneers be fitted on top of existing bonding, or does the bonding need to be removed first? We cement porcelain veneers with a composite material. So it's the same family of material that's used for composite bonding. If the composite bonding's been done well, then there's no reason why you can't cement porcelain veneers over the top of it. If the bonding's old, stained, might have leakage, then it would be better to remove it and replace that bonding with porcelain. Do they stain like bonding does? You're a lover of coffee and red wine. You know what? Porcelain veneers do not stain. They are made out of porcelain. And if you imagine a porcelain plate and how it just wipes clean, it's the same thing with porcelain veneers. So when you have your porcelain veneers and you go to a party and everyone's drinking red wine, then you will be the only person in the room that doesn't get that kind of red wine type teeth. You'll have your beautiful white clean looking porcelain veneers. Lastly, with veneers, do they also need to be replaced? And if so, after how long? I used to tell my patients their veneers would last 10 years because that's what the in vitro studies showed. But I found within my own career that they're lasting for 20 years. So now we believe that with the current protocols that veneers and the cement last for 20 years, but I would actually expect it to last for 30. So not forever, but a pretty long time.